I'm Professor Torsten Nielsen, and I'm a researcher at Vancouver General Hospital at the University of British Columbia. And I'm one of the lead investigators in the ImmunoSarc grant recently funded by Liddy Schreiber. We are involved to try and bring this exciting new concept of immunotherapy into the world of sarcoma work, where there hasn't yet been quite as much research done as in some other types of cancers. So our goal is, among other things, to determine which kinds of sarcomas have strong immune infiltrates and might be the best candidates for some new and exciting immunotherapies. Specifically, my role within the group is to help build tissue microarrays and assess large numbers of different kinds of sarcomas for their immune infiltrates. And how we do that is we start with tissue blocks. I'm a pathologist from a pathology lab, and you may not know this, but every patient who has surgery always has their tissue dissected by a pathologist, and eventually, through a series of processing steps, embedded in paraffin wax to create these treasure troves of archival tissue blocks. We have many thousands of them, many thousands of them, as you can see, and that's why even for rare sarcomas we can find lots of examples and be able to determine what kind of immune infiltrates they have. And the way we go through these large numbers of cases is we build something called tissue microarrays, and I'll show you how that's done. This is a tissue microarray right here, and we take these individual cancer specimens, poke small, tiny cores out of them, just 0.6 millimeters across, and build them up into something called a tissue microarray. With this relatively simple device, it requires careful skill to do it, but at the end of it all, we end up with a series of things like this. This is called a tissue microarray, and each one of those little dots is a different sarcoma specimen. There's several hundred on here, and we have thousands and thousands of them built up. Not only here in Vancouver, but our colleagues in France and in New York City have done the same thing. So we can put these together to have really large series. Those get cut on these microtomes, then stained on our automated immunostainer device here, and then scanned in digitally to create a digital archive. What you see here is an example of a cancer zoomed in and a grid of cancers being scanned in, so that we capture digital images that go on a server. Those can then be scored either here or in New York, in Paris, or in Australia by our other collaborators on the grant on one of our digital scoring stations. So at the end of all this work, what we'll have is a comprehensive description of which types of sarcomas have immune infiltrates of different kinds and might be the most likely to respond to new forms of immunotherapy that we think will give hope for cancers that might otherwise have been untreatable with current methodology. Thank you for all of you who funded this research, and we hope we'll be able to help patients with sarcoma with its results.